Ladies and gentlemen, my name is Dickson Karani. I'm a clinical nutritionist at Consolatal Hospital in Kobo, and today I would like us to discuss nutrition management of diabetes. As we know it, this is a condition that has affected our population that we serve, and even population beyond. It is a very common disease. And what is this diabetes? When we say diabetes type 2, what is it? This is a metabolic disorder that is caused by inability of the body to produce insulin, or inability of the body to use or utilize the insulin that it has produced. And this one will consequently lead to improper metabolism of nutrients, precisely carbohydrates, and therefore you will have this condition of diabetes. Diabetes is managed in two ways. It is managed pharmacologically, that means it is managed with drugs, and non-pharmacologically means that it is managed without drugs. And where we have non-pharmacological management, that is where nutrition management comes in. It is managed, number one, by the diet, number two, by lifestyle, and number three, by exercise. When you talk about diet, we are aiming at food selection. When you have diabetes, it is very good that you select foods that, number one, have low glycemic index, and foods that have low glycemic load. These foods are mostly whole grain, and a food being brown in color does not necessarily mean that it is a whole grain food. So when you visit our nutrition clinic, we will be able to differentiate these whole grains, and you will have we will have optimized your glycemic levels using these carbohydrates. Number two is the food frequency and food patterns. Through our meal plans that we will draft with you, we will sit down with you and come up with a meal plan. In this meal plan, we will have the number of meals that we are going to take, the portions that we are going to take, and how many times you are going to take during the day. Through that meal plan, you will not have elevated blood glucose levels, and you will not have low blood glucose levels. I would like to say that a meal plan is individualized. A meal plan is not generalized to patients, because your diabetes is not an equivalent to another patient diabetes. Every patient has individual needs when it comes to nutrition requirements. We will also demonstrate to you a diabetic plate model, how food should appear in your plate. If we say a half section should be vegetables, we should be able to specify what kind of vegetables they are, non-starchy vegetables, and we will give you examples of those vegetables that are locally available and easily accessible within our locality. We will also teach you or educate you on food care and general hygiene practices, so that you will not have complications like diabetic foods later in life. And therefore, we would like to welcome you to our nutrition clinic, so that also we are going to discuss about exercises that you require during this period. Remembering again, obesity and overweight are the risk factors in developing diabetes and hypertension. I would like to welcome the population we serve and even beyond, so that they can come and be partakers of this knowledge, and diabetes should not be a problem to you anymore. Elevated blood glucose levels should not be a problem to you. Welcome, welcome, welcome. Next time, we are going to discuss, or we are going to talk about nutrition in hypertension. Welcome, welcome, welcome all.